11 alerts from your body that may be the first signs of leukemia. Don't ignore it. Have you ever felt tired all the time, even after a good night's sleep? Did you notice bruises on your body without remembering being hurt? Or maybe you've noticed that you've been getting infections more often than usual? What if I told you that these could be signs of something much more serious than you think? Leukemia is a type of blood cancer that may be silent at first, but shows signs that the body tries to give. The problem is that many of these symptoms are mistaken for common everyday problems. And because of this, many people end up ignoring these warnings and discover the disease too late. But what if there was a way to identify these signs as soon as possible? What happens to your body when leukemia starts to develop? And what are the symptoms that cannot be ignored at all? The answer to these questions can make all the difference. Let's get started. 1. Extreme fatigue, when tiredness can be a serious warning. Have you ever felt so intense that no night's sleep seemed to solve it? Extreme fatigue is one of the first signs of leukemia and often goes unnoticed. This happens because the disease affects the production of red blood cells, responsible for transporting oxygen in the sang. Come less oxygen circulating through the body, many muscles and organs do not receive the energy necessary to function properly. The result? A constant feeling of weakness, discouragement, and exhaustion, even without excessive physical exertion. This fatigue goes beyond normal. It does not improve with rest and may be accompanied by dizziness, difficulty concentrating, and even palpitations. Many people attribute this symptom to stress, an intense routine, or lack of sleep, without imagining that it could be a sign of something much more serious. If you've been feeling exhausted for no apparent reason, it might be time to pay more attention to your body. Is this fatigue just fleeting or a warning that something is wrong? 2. Pallor and shortness of breath. Is your blood giving warning signs? Have you ever looked in the mirror and noticed that your skin was paler than usual? Or did you feel short of breath when performing simple everyday tasks? These symptoms can be signs that something is not right in your body. Leukemia directly affects the production of red blood cells, causing a condition known as anemia. Come fewer red blood cells, oxygen is not transported properly through the body, resulting in pallor and breathing difficulties. At first, these changes can be subtle. The person may notice that they are more breathless when climbing stairs or walking for short periods. Calm time, even basic activities such as talking or getting out of bed can cause extreme tiredness. Pallor can be perceived not only on the face, but also on the hands, gums, and inner eyelids. Often, family and friends are the first to notice this change, as it occurs gradually. If you've been experiencing shortness of breath for no apparent reason, or have noticed that your skin is paler than usual, it may be time to investigate. It may just be a stress phase, but what if it's something more serious? 3. Bruises and unexplained bleeding. What do they hide? Have you ever noticed purple spots appearing on your body for no apparent reason? Or have you noticed that small cuts take longer than usual to stop bleeding? When leukemia begins to develop, one of the first impacts happens to platelets responsible for clotting the sang. The reduction in the number of these cells, any small impact can cause bruising, and simple cuts can bleed for a long time. The most worrying thing is that these bruises usually appear without the person remembering having hurt themselves. They appear mainly on the legs, arms, and regions where blows do not normally occur. In addition, there may be spontaneous bleeding from the nose and gums, something that often goes unnoticed at first. Another common sign is small red dots on the skin, known as petechiae. They occur due to small leaks of blood under the skin and are a warning that the circulatory system is compromised. If you've noticed that you're bruising easily or experiencing unusual bleeding, don't ignore it. It may only be a temporary problem, but what if your body is trying to warn you of something more serious? 4. Infections that won't go away. Is your immune system in danger? Have you been catching colds and flu more often than usual? Have you noticed that small infections seem to take much longer to heal? Our immune system relies on white blood cells to fight off viruses, bacteria, and other threats to the body. However, when leukemia sets in, the production of these cells becomes uncontrolled. The body starts to produce defective white blood cells, which cannot fulfill their defense function properly. The result? Constant infections, which do not respond well to conventional treatments. Sore throat, persistent cough, recurrent fever, and even small skin sores that do not heal can be warning signs. Many people ignore this symptom, believing that they are only low in immunity due to stress or inadequate nutrition. But when infections become repetitive and take time to pass, it is an indication that the immune system may be seriously compromised. If you have been experiencing persistent infections for no apparent reason, pay attention. Is your body just going through a rough patch or trying to warn you of something much more serious? 5. Bone and joint pain. A silent warning from your body. Have you ever felt unexplained pain in your bones or joints, even without having made physical effort? Does this pain appear and disappear for no apparent reason? Leukemia begins in the bone marrow, where blood cells are produced. Come the disease progresses, the marrow becomes overloaded, and this can cause persistent bone pain. This pain can be diffuse or localized, usually affecting the legs, ribs, and spine. In the joints, pain can be confused with common inflammations, such as arthritis, and so many people take time to realize that something is wrong. But unlike typical joint diseases, the pain caused by leukemia tends to be constant, even at rest. Often, the sensation is described as an internal pressure on the bones, unlike common muscle pain. If this symptom is ignored, it can intensify over time and become disabling. If you've been experiencing bone or joint pain without a plausible explanation, don't ignore it. It may just be a passing problem, but what if it's an early sign of something more serious? 6. Swelling in the lymph nodes, liver, or spleen. What does it mean? Have you ever noticed abnormal swelling in your neck, armpits, or groin? Or did you feel abdominal discomfort for no apparent reason? Swollen lymph nodes are one of the most common signs of leukemia. The ganglia are part of the body's defense system and usually react when there are infections. However, in leukemia, this swelling happens without a clear infection and can last for weeks. In addition to the lymph nodes, the liver and spleen can also increase in size. This is because these structures compensate for the abnormal functioning of the cells of the sang. Time, this swelling can cause abdominal pain, a feeling of heaviness on the left side of the body, and even loss of appetite. Often, people only notice the enlargement of the lymph nodes when they touch the affected region. The growth of the liver and spleen can be identified by tests or by constant discomfort in the abdomen. If you've noticed persistent bloating or unexplained abdominal discomfort, pay attention. Your body may be trying to warn you of something that shouldn't be ignored. 7. Night sweats and weight loss. When does it become a warning sign? Have you been waking up with sweat-soaked bedding, even on cold nights? Or have you noticed that you are losing weight without having changed your diet or routine? Excessive night sweats are a symptom that is often overlooked, but it can be an important warning. In leukemia, the body goes into a constant state of alert, trying to fight off diseased cells. This internal effort can lead to intense episodes of sweating during the night, with no apparent explanation. In addition, sudden weight loss for no clear reason can indicate that something is not right. The body starts to spend more energy to deal with the disease, resulting in involuntary weight loss. Many people only notice this change when clothes start to become loose or when family members comment on their thinner appearance. While sweating at night or losing weight can have multiple causes, when these symptoms occur together and without explanation, it's time to turn on the alert. Is it just stress or your body trying to warn you of something more serious? 8. Frequent headaches and dizziness. Is your brain suffering from the disease? Have you been experiencing headaches more frequently than usual? Have you ever noticed episodes of dizziness for no apparent reason? Leukemia can affect blood circulation and reduce the transport of oxygen to the brain. This can cause persistent headaches, dizziness, and even difficulty concentrating. These symptoms are often ignored or attributed to the stress and tiredness of everyday life. However, when they occur frequently and without an apparent cause, they can be a sign that something more serious is happening. In more advanced cases, leukemia can lead to episodes of blurred vision, ringing in the ears, and even fainting. These signs indicate that the brain is not receiving enough oxygen, which can compromise several body functions. If you've been experiencing constant headaches and episodes of unexplained dizziness, pay attention. Your body may be trying to warn you of something important before the problem gets worse. 9. Red spots on the skin. What do they reveal about your body? Have you ever noticed small red spots on your skin that don't go away over time? Have they come on suddenly and don't seem to be related to allergies or irritations? These small marks, known as petechiae, can be an early sign of leukemia. They appear when small blood vessels called capillaries rupture due to the low amount of platelets in the blood. Unlike common rashes, petechiae do not itch, do not cause pain, and do not disappear when pressing on the skin. They usually appear on the legs, feet, and even on the face, especially around the eyes. Many people ignore this symptom because they think it's just passing irritations. However, when petechiae appear for no apparent reason and spread throughout the body, it is a strong warning sign. If you've noticed red spots on your skin that won't go away, don't ignore it. It may just be a harmless change, but it can also be a silent warning of something much more serious. 10. Wounds that take time to heal. A symptom you shouldn't ignore. Have you ever noticed that small cuts or bruises are taking longer to heal? Or that simple wounds seem to become infected easily? Leukemia can affect the body's ability to recover from injury. This happens because the disease compromises the production of platelets and white blood cells, which are essential for coagulation and the body's defense. When there's a reduced amount of these cells in the blood, cuts and scrapes take longer to close. In addition, a lack of healthy white blood cells weakens the immune system, making the body more vulnerable to infections. Often, simple wounds begin to become inflamed, painful, and even pus-filled, even for no apparent reason. What should be a quick healing can become a long and problematic process. If you've noticed that your wounds don't heal as they used to, or suffer infections easily, don't ignore them. It may just be temporary low immunity, but what if it's a sign of something more serious going on in your body? 11. Loss of appetite and feeling of a full stomach, a sign that can go unnoticed. Have you ever felt like you've lost your appetite for no apparent reason? Or have you noticed that, even eating little, you feel your stomach full quickly? Leukemia can cause an abnormal enlargement of the spleen, a condition called splenomegaly. When this happens, the organ begins to press on the stomach, resulting in a constant feeling of satiety. Even after small meals, the person may feel full and unwilling to eat. This change can lead to rapid and unexplained weight loss. As the body is already weakened by the disease, the lack of nutrients can further aggravate the symptoms of leukemia. In addition, some patients report discomfort or pain in the abdominal region, especially on the left side, where the spleen is located. This symptom can be confused with digestive problems, such as gastritis or reflux, leading to misdiagnosis and delaying the identification of the disease. If you've been feeling that your appetite has changed drastically, or that your stomach fills up easily, pay attention. It may be just a passing change, but it can also be a silent sign that something is not right in your body. If you've noticed one or more of these symptoms, don't panic. But don't ignore it either. Many of these manifestations can be caused by other, less serious conditions. However, if they persist or intensify, it is essential to see a doctor for a detailed evaluation. Leukemia may be silent at first, but recognizing the signs in time can make all the difference in diagnosis and treatment. The earlier the disease is identified, the greater the chances of successful treatment. If you know someone who has these symptoms, share this information. Many lives can be saved simply by paying attention to the signals that the body gives us. Take care of your health, listen to your body, and never ignore a persistent symptom. Information can be your greatest ally in the fight against serious diseases.